My name is Carrie Firestein. I am Chief Executive Officer of Allied Physicians Group, practicing pediatrician for over 30 years on Long Island, mother of 3, and now grandmother of 3. A very short time ago, that was just 1, but things are moving. So my 3-year-old grandson tried to sign up for youth soccer, but he was closed out. So that's what a big deal sports is these days. You can't even get a 3-year-old on. And as much as I keep telling my patients that summer is not over, we do kind of see Labor Day very close, looming, and school starts. And that's when the youth sports and all of the teams start off really seriously. And youth sports is a serious business, much more serious certainly than when I was growing up, but even when my children, who are now in their 30s, are growing up. And with that comes a lot of questions, a lot of potential for injury, a lot of wonderful good things too involved in youth sports. And we're going to talk about all of that tonight. We are lucky to have one of the allied pediatricians, and then a specialist, a pediatrician who specializes in sports, and I'm going to let them introduce themselves. So, Dr. Levine?
I'm Eric Levine. I'm a practicing pediatrician in White Plains in Westchester County, New York. I've been practicing for 30 years in White Plains, and as Dr. Firestein said, youth sports is big. My son started soccer at 3 and loved the sport. He learned a lot, and it was great. But as a pediatrician, I see all the injuries and makes me crazy. And I'm looking forward to learning from Dr. Greene this evening.
Okay, Ben.
Thanks so much for having me, and congrats, Dr. Firestein, on your rapidly accelerating grandparenthood. That's big news. I'm Ben Greene. I'm a primary care sports medicine physician. So what that means is I did a pediatric residency and then a fellowship in primary care sports medicine. So I'm a non-operative sports medicine specialist. I work at Orthopedic and Neurosurgery Specialists, or ONS for short. And we are located kind of throughout the Southern Connecticut and Westchester area. And that's where I spend most of my time in our office in Harrison and Westchester. And today I'm going to be talking about a bunch of different topics relating to youth sports, but mainly focusing on injury prevention and early sports specialization. So,
great. And before Dr. Greene starts, we are going to be taping this. So we will be able to send it to everybody who's registered. If you have to drop off, we're able to send it to you, and you will be able to send it to friends. So you'll be able to do that. Any of the references we make today or the recommendations, Dr. Greene will help us get that in some format so that you can have as well. If you have any questions, you can throw them into the chat. We'll answer some of them as we go. Dr. Greene's presentation will be about 35, 40 minutes, and then we will have time for questions at the end. So go for it.
All right, I'll go ahead. Oh, I have to share my screen, but it's not. There we go. Okay. Everybody seeing the PowerPoint? Great. Okay. So I'm gonna this is the amalgamation of 2 different lectures fused together. I'm gonna start with going over some strength conditioning and injury prevention tips and tricks in the youth athlete. I have nothing to disclose. So I'm gonna start by going over some background information, talk about risks and benefits associated, some training recommendations. We'll take a branch off and focus specifically on ACL injury prevention. We'll talk about performance-enhancing substances very briefly, and then finish up with some take-home points before going into the next lecture. So just starting with some background and definitions. So I'll refer a lot to this notion of resistance training, and for all intents and purposes, that is strength training. That's a specialized method of conditioning that is designed to enhance muscular strength, power, and endurance. And depending on how involved you are in resistance training and that entire world, you may come across different terminology like training age or RTSC, resistance training skill competency. Basically, those are two different ways to kind of assess and quantify the experience and abilities of an individual and their ability to kind of perform resistance training. So going into some risks associated with resistance training, overall injury rates in youth resistance training settings that are, and most importantly, I will emphasize this throughout the lecture tonight, properly supervised, are actually lower than those occurring in sports or at recess. A lot of people are surprised to learn that, but it's really only in situations where there's resistance training occurring without proper or with poor supervision, if kids are trying to lift too much weight, or if they are trying to do too much without having given themselves proper rest time in between other sporting activities, that's where they are setting themselves up for these injuries. The big risk associated with resistance training is overtraining, and I'm going to get into that a little bit later on in the lecture, but basically prolonged training with heavy loads and without adequate rest and recovery between sessions have been correlated with increased injuries and illness. That correlates with the notion or entity of overtraining or burnout, which again, I'll go into in more detail later, but essentially that's fatigue and declining performance and can manifest in a number of different ways and sometimes more subtly than obvious. So just because we're a group of pediatricians, what lecture would be complete without referencing the AAP? So the AAP recommends rest from competitive athletics, sport-specific training, and practice by taking 1 to 2 days off per week to allow for physical and psychological recovery. Very important. What about skeletal risks? So those programs that are appropriately designed and are properly supervised actually have demonstrated no negative effects on linear growth or the health about growth plates. There are potential injury risks for types of injuries where pieces of bone get pulled off because they are the relative weak point to the attaching ligament. But those are types of injuries that any athlete is susceptible, whether engaging in resistance training or just out on the practice or playing field. So as long as things are properly supervised, there's really not much of an injury risk or a risk to overall growth. Now, it's not necessarily appropriate to say all kids are okay to engage in resistance training. There are certain medical conditions that would potentially, disqualify, or potentially you might have to make some activity modifications for that individual student, athlete, or child with regards to their specific medical conditions. These might include things like poorly controlled high blood pressure, an uncontrolled seizure disorder, certain intrinsic heart conditions like hypertrophic cardiomyopathy, which is structural changes in the heart that predispose to some potential serious consequences with a large level of exertion, high blood pressure in the lungs, or certain genetic conditions, all of which our friendly pediatricians on here are routinely screening for. And so certainly if there's any concern for that, that would be raised oftentimes in the pediatrician's office, and then further testing is typically indicated. Now, moving on to benefits, of which there are plenty. So obviously, if people are doing resistance training, it's to get stronger, right? That's the native goal that everybody assumes. It should be known, though, that you can make strength gains in different ways, and that depends on your age and your relationship to puberty, whether you're prepubertal or postpubertal. So kids that are prepubertal can still make strength gains, but it's not necessarily by, developing these large bulking muscles, but rather by recruiting and increasing the number of motor neurons that fire in those muscles, and it allows them to fire at a stronger amplitude. Now, post-pubertal, that's where you see the typical associated muscle changes that you'll see if you go to any gym, right? You're going to see bodybuilders with large muscles. That all comes post-pubertal, but that's not to say that you can't get stronger if done properly pre-pubertal as well. Other benefits include improved motor skills, improved speed and power, this notion of increased physical literacy, which is this intertwining connectedness between skills, confidence, motivation, and proper knowledge of how to engage in these types of activities. And interestingly, resistance training reduces risk of injury. So not only does it not increase the risk, but it can actually help to reduce the risk of injury if done properly. There's other health benefits. Obviously, there's going to be improved cardiovascular fitness. Resistance training alone can often increase aerobic training, and we'll talk a little bit more about that later on. And then there's combined programs, which are a combination of cardio or aerobic training along with resistance training, and those are most beneficial. So those are more beneficial than either cardio or resistance training alone. Resistance training will also improve body composition, can make bones stronger by improving bone mineral density, can improve the lipid profiles like your cholesterol, can improve the insulin sensitivity in youth that are overweight. And obviously this is paramount, and especially coming off the heels of COVID, where mental health was so crucial, and we all know and understand and appreciate the relationship of exercise with mental health. So in terms of some specific training recommendations and tips, what would typically be recommended is for children, and this is typically ages kind of 5, 6, 7 and up. So not those super young kids, but they have to be able to have the emotional maturity to follow directions and engage in things properly, right? So that's really the audience that we're kind of catering to here. But some specific recommendations are, it's totally okay to do 20 to 30-minute sessions 2 or 3 days a week, obviously on non-consecutive days, because you have to build in time for rest. And there's been studies that have shown that if you can do a training program for greater than 23 weeks, that is the sort of time limit that has been demonstrated to be most effective in attaining maximal strength gain. So it might not be enough just to do something for 2 months. You might have to do it for significantly longer to see those results that you want to see. Now, in terms of recovery time, this will differ depending on age and kind of how experienced you are with your resistance training. So beginners, younger kids tend to recover faster, so they only need 1 minute of rest typically in between sets. More advanced resistance trainers who are probably doing much larger loads, heavier loads, they need a little bit more time, 2 or 3 minutes of rest in between sets. I always recommend starting light with probably more repetitions than weight, right? So high rep, low weight. That's one nice recipe to avoid any injuries. The key here being the focus should be on developing perfect and proper technique. And by doing that, that really goes a long way in reducing the risk of sustaining an injury from resistance training. A lot of people, myself included, will often neglect the core because it's such a burden to exercise the abdomen, and people really, just try to skip it at all costs. But it's really important for so many different things. Your lower back, both muscular and spinal health, your hips. It really goes a long way with knee health. So it's really important not to neglect the core. And then there is this notion of, some people may be familiar of this 1 rep max. That simply refers to a properly supervised setting where someone is trying to basically max out or lift the most amount of weight that they can safely and properly. And then that maximum weight is then used to dictate more detailed strength and resistance training programs. Now, switching gears a little bit about ACL injury prevention. ACL injury is very common and obviously a very debilitating injury requiring at least 9 months of recovery at a minimum, usually sometimes even closer to a year. And these can be very devastating injuries. So obviously we want to do as much as we can to prevent them. And there's been a large focus that has gone into developing certain prevention strategies. So just in terms of how common they are, surgeons are performing on average around 400,000 ACL reconstructions per year. That's your typical ACL post-injury surgery, is called a reconstruction. They are more common in females, and they do tend to happen more at a younger age. And that's probably because they're more common in athletes, and athletes tend to be younger. So there have been a lot of strategies, and we've spent a lot of time looking into what kind of factors can we try to improve that might help to benefit ACL injury prevention. So we've looked at things like balance, flexibility, strength, jumping and landing mechanics. So taking a little bit of a detour, I mentioned that ACL injuries tend to be more common in females, and you might be asking yourself why. So there are physiological differences in the male versus female anatomy that might predispose to this injury. So first of all, when it comes to landing mechanics, females tend to be more quadricep dominant and males tend to be more hamstring dominant. So what that means is the quads are obviously the thigh muscles in the front and the hamstrings are those in the back. So when females are landing or coming down from a jump or pivot, things like that, they tend to land with their knee more straight and their hip flexed versus the opposite for males. They also tend to land with their hip turned slightly inward and closer to that midline rather than outward, a more stable, wider base. There's also this measurement called the Q angle, which if you look at the diagram on the right, obviously females are genetically constructed to carry a developing fetus, and so therefore their hips tend to be wider, and as a result the angle that is formed between the outside of their hip bones and the knee makes this larger angle, and so that puts more stress and force on that ACL, especially in times of pivoting or cutting or landing. And so those are all reasons why these types of injuries might be more common in females. Now, in terms of what we've actually learned and what can be helpful in terms of preventing injury, ACL injuries, there has been developed this very well studied and now validated program called the FIFA 11 program, which is very easy to look up and implement with preseason and sports of all different types. And a lot of high schools and colleges are in fact using this throughout the country and internationally as well. So basically, this is a preset program that is designed to improve all of those factors that we talked about before. And they are useful both in the preseason and throughout the season. And what the data has shown is that by doing these exercises, it has led to not only a reduction in ACL and knee injuries, but all injuries in general. So this is a very helpful program, very easy to implement, and can be really useful in ACL and all injury prevention. One of those things I wanted to highlight that I'll just go back here. So involved here is something called the Nordic hamstring exercise, which is, if you have never tried this, they are really tough. But if you can get the hang of it, these are probably the most helpful exercises you can do to build hamstring strength. So it's being exercised or demonstrated in this GIF or GIF, whatever you'd like to call it, on the left here. Basically, you're trying to control your descent down to the mat as slowly as possible, engaging these hamstring muscles as they are getting longer. So this is a type of an eccentric strengthening exercise, which is really important as it pertains to muscle and tendon strength building. This is Tyreek Hill. I'm not sure if anyone on the call is a big football fan, but he's one of the best receivers in the NFL. He put out some videos. There was a viral chain of athletes doing these Nordic curls, and he just went full beast mode on these, and it's no surprise that he is one of the fastest players in the NFL. Once you watch his ability to do these, he can just crank them out. So very briefly, touching on performance enhancing substances. This is a big topic, obviously, unto its own, and really deserves a lot of time and dedication. But generally speaking, the American Academy of Pediatrics strongly opposes the use of performance-enhancing substances and vigorously endorses efforts to eliminate their use among children. That obviously is very wide-ranging and encompasses a number of different drugs, such as steroids or supplements. But generally speaking, kids don't need any of these things. They just need proper diet and hydration, making sure to focus on, with regards to their diet, 3 meals per day, eating their fruits and vegetables. It's not just lip service. We're telling our kids to eat their vegetables for a reason, because it really goes a long way in helping to make them stronger and also to recover from exercise quicker. So just some quick take-home points. When done properly with supervision, resistance training is a safe, effective means of improving performance and overall health. An age range of 5 to 7 is typically reasonable to begin strength building. However, that's not with, putting them on the bench press or having them do bicep curls, things like that. These are child-friendly exercises like frog jumps, bear crawls, crab walks, kangaroo hops, basically anything having to do with an animal, it turns out, or one-leg hops. And these are fun for kids, so they don't necessarily even associate these as exercises that might help to build strength, but they absolutely can accomplish that goal. With your overweight or obese youth, obviously physical exercise is very important. A lot of people will be resistant to just jumping into cardio, which we know can be very effective in weight loss combined with proper dietary changes. But a lot of people don't want to just do cardio. And what has been studied and proven is that if you at least start them with some resistance training, it will make them more motivated and more likely to then engage in a combined program that also incorporates cardio. So if you're having patients or if your child is resistant to, getting more active, then start with some resistance training and build off of that. Very important in terms of injury prevention, always to include a dynamic warm-up before any exercise, as well as a proper cool down with some gentle static stretching. And then, as I just discussed, right, always important to properly hydrate several hours before the event starts. That's when proper hydration occurs, as well as proper nutrition throughout the day and consistently. So then moving on to, I want to talk a little bit about early sports specialization. It's a very hot topic and can get a little controversial, but I think it's really important to talk about, especially this day and age where there are so many pressures being put on very young children to develop into, incredible athletes. That's the goal, right? So one of the ways that people have tried to accomplish that goal is by, putting them in for one sport and really just focusing on that one sport. And so I wanted to talk about whether or not that's helpful or could it be harmful, and go into that a little bit. So we define sports specialization as intensive year-round training in a single sport at the exclusion of other sports. It's a spectrum of definition, but basically they choose one sport. It's all year, meaning at least 8 months per year, and they quit all other sports. Typically, when I refer to early sports specialization, that's referring to prepubertal, which is usually around 7th grade, 12 years on average, depending on males versus females, but that's a good average. And then as a result of them doing all of these sports, the other consequence is they have very limited free play, which we'll talk about in a little bit, but is very important to childhood development. So again, going into some reasons or motivations why a young athlete might specialize. So there's varying motivations, right? They want to be the GOAT. They want to, be top high school, collegiate, hopefully even professional athletes. I know that up until I was probably in middle school and saw my first curveball, I wanted to be a professional baseball player. And then I saw that and I said, okay, maybe I'll transition and be a doctor instead. But if you ask most kids, right, a lot of them are going to say that they want to be professional athletes. So there's this intrinsic motivation to accomplish that feat. Sometimes there's financial motivations, right? They want to get a scholarship to go play in college, or make a lot of money by playing professionally. And they also watch sports on TV, and they see all of these heroes of theirs performing at high levels, and they want to be like them. So naturally, it makes sense that if you want to be good at something, you have to do it a lot, right? Well, there's other people that are also motivating these youth athletes to specialize, right? It's not always intrinsic. We often have parents or coaches or trainers or even the media that are kind of sculpting these young minds and maybe pushing them more so into early sports specialization. So first and foremost, is it safe? So this is a nice little chart here that kind of goes into degree of specialization and how that pertains to risks of overuse injuries and acute injuries. And basically, what you see here is for those that are not overly specialized, right? So they play multiple sports and they don't play one sport for greater than 8 months of the year. They engage in free play. Their overall risk of injury is low. Their risk of serious overuse injury is low. And the risk of acute injury is moderate, okay, that's common, right? A lot of kids play sports, and sports injuries happen. I wouldn't have a job if that weren't the case. If you go into those that are more highly specialized, then you can see here that risk of, a little interesting, right? Risk of overall injury is high, risk of serious overuse injury is high, risk of acute injury, not necessarily that high. So early sports specialization does portend to an increased risk of overuse injuries, which are the more common types of injuries that we see in youth athletes. So now going into some more specific kind of sports and breakdowns. So year-round training is an important proven risk factor for injury. So it is a known risk factor. And specifically, right, if you're a pitcher and you pitch for greater than 8 months per year, that's been directly correlated with development of shoulder or elbow injuries like little league shoulder, little league elbow, which are kind of those precursor conditions and potentially may lead to your more adult injuries like a UCL tear, the Tommy John ligament injury. And this is commonly seen in athletes that engage in one sport without any breaks. So, by doing these repetitive skills, that in a child who is not yet skeletally mature, right? That's an important notion to comprehend, is that as the body grows, you have growth plates that are open all over the body, and that allows the bones to get longer, and then the soft tissue follows suit. And that's how we get bigger, both in terms of length and girth, right? And if your growth plates are open, they are potentially susceptible to injury. So some specific potential injuries that we see in those that are early specializers, if you're a tennis player, demonstrated there, that's something called a kick serve, which is really difficult to return, but can also lead to an increased risk of shoulder or elbow injuries. In our competitive gymnasts, they often have overuse injuries related to their wrists and their growth plates in their wrists. And then, as I mentioned before, with pitchers, right? If they are, and there's a lot more factors that go into it, such as pitch type, volume, the number of pitches per inning, innings per year, things like that, and especially poor mechanics leads to an increase in elbow and shoulder injuries. So the other risk comes with overscheduling, right? So there is placed this increased competitive demand on specialized athletes. They have to engage in more frequent and intense competition. There is an increased risk, therefore, of injury with the competition. And then because they are doing too much throughout the week, there's no time to rest, right? So they have inadequate rest and recovery periods, which therefore also increases risk of recovery, or excuse me, risk of injury. The other, big risk that I touched on briefly before is this entity of psychological burnout. So basically, there's an increased pressure in intense, often adult-driven specialized training and competition. And early sports specialization can be isolating, create these feelings of a lack of control for these young athletes, and lead to decreased preparation for dealing with stress and anxiety. It's really important that kids enjoy free time They just get to go out and be kids. That's really important for both skeletal health and for mental health. We see it all the time, and more increasing recently, especially with some Olympians, right? Simone Biles, excuse me. Right, she had a large issue in the Olympics a couple of years ago and had to kind of disqualify herself from competition. Actually, just saw that she came back and won a major competition. So that's great for her. She's overcoming these burdens, but for those Olympians, those are the textbook cases for, kids who got started very early and very young, and they probably dropped all other sports, and that's really all they focused on from a very young age, and it leads to immense pressure. So how that can manifest is in certain characteristics, like kids lose their intrinsic motivation. It has to come extrinsically from parents, coaches, trainers. They stop having fun, right? Sports are meant to be fun, and these kids aren't having fun doing the sport, right? So what's the point? They have very high perceived stress and anxiety. They don't have proper coping mechanics to deal with that stress and anxiety, and they also have increased fear of injury at a young age. And this will also manifest with mood disturbances, social isolation, eating disorders can be especially prevalent in this population. And then it's going to lead oftentimes to dropout, right? They're not going to want to do that sport anymore, and they're going to quit early, and they're going to miss out on the potential benefits of if they had not specialized and been able to kind of properly enjoy that sport. So now, enough with the negative. What are the benefits of early diversification, right? The opposite of early specialization. So this will lead to enhanced physical literacy, which we talked about before. It's going to help to facilitate motor skill development and make people more coordinated. It's going to increase psychosocial and cognitive skills. Your kids are going to develop protective neuromuscular patterns. There's going to be this crossover effect of multiple sports where spending time playing soccer, for example, is actually going to make the kid a better basketball player. And that might not make intuitive sense, but if they can develop much better footwork, for example, doing soccer, then that is going to translate on the court as well. Early diversification also, very importantly, accommodates psychological well-being. So how can we best protect our young athletes? And I would say that we should avoid specialization prior to puberty. There are some nice tips and rules of thumb in terms of when you ask yourself, how much is too much? So a nice rule of thumb that I like to tell parents is that kids really should not be exceeding their age in terms of number of years, age in years in terms of number of hours per week, right? So if you have a 12-year-old athlete, they should not be spending more than 12 hours per week of doing athletic events. And then we also, very importantly, need to allow for them and allow for time for them to engage in free play. We need to encourage age-appropriate and supervised strength and conditioning programs as well, which we talked about before. So without further ado, I'd love to open up the field to any questions about either of those two lectures. And then I didn't mention before, but I'm also the director of our concussion center. So I would also be happy to answer any concussion related questions as well. Thanks so much.
Thank you, Ben. That was so good. And we're doing all these checkups for school. I've had 2 teenage boys, one come in after the surgery for his UCL, and the other one is showing me that he can't bend his arm. Like, it's just, he hasn't had surgery, he's doing PT, but he can't bend his arm. So these are, very real things. And as pediatricians, we end up dealing with the consequences of it. And I would love to be able to help and give more guidance, early on so that we can help people. So you talk about properly supervised. As a parent, how do you know that your child is being properly supervised? Because, coaches have varying degrees of expertise.
It's a really good question. We have to do our best, right? So, ask your child questions about what it's like in the gym, right? Is it one coach who's watching 30 athletes? That would probably mean that they're probably not able to pay attention to everybody at the same time, and there are potential lapses, and it's possible that kids are improperly doing things. So I would say focusing on a setting where there is a good ratio of supervisors to participants is one way to help to kind of mitigate that. And then also vetting, right? Is it some Joe Schmo that they just took off the street to kind of oversee things who doesn't really have much experience? Or is it a coach who, also spends a lot of time working on physical fitness and can really speak with experience and knowledge about those types of things? And if there's ever any concerns, I think it would be fun to have kids kind of demonstrate without weight, right? What they're doing in terms of form. And you can always reference on YouTube or on the internet, right, what proper technique and form looks like. So you can watch those videos with your kids and make sure that they are, watching exactly what's happening and they're trying to reproduce or emulate that proper technique.
So you mentioned the 5 for 2 exercises. Is that something you should expect that your travel soccer club is doing with your children?
I would be surprised if most weren't at least incorporating some elements of that. Depending on the competitive level of it, they may not be doing the full program, and they may not be starting it in the preseason, or maybe they're only doing it once per week instead of 2 or 3 times per week. But like I said, there's been a lot of research that's gone into this topic, and really that's been the program that has been best developed and validated through all of these studies. And so I think there's a decent shot that for any competitive team where kids are very serious about their craft, it's likely that the coaches are implementing at least some portion of that.
And parents can find this online by Googling it?
Absolutely. It's the FIFA 11.
Okay. Dr. Levine, do you have any questions?
I have a bunch of questions. It has to do with what I see come into my office. And I'm just going to go down my list of questions here. When you talk about ACL injuries and teenagers, I do get and having have a torn ACL in my left leg, I get a lot of questions on they injure themselves, ACL braces, over-the-counter ACL braces, custom braces. Are they preventative? Are they not preventative? Should they be recommending in sports where ACL injuries are more common? Parents are asking me, should they be doing those things, and does it help prevent the injury?
Great question. I get it often. And long answer short is no, really, there's no good bracing to protect against ACL injuries. It's really the focus needs to be on the strength training and landing mechanics and things like that. If you watch the NFL, you'll see a lot of players wearing knee braces, and most often it's linemen, and that's more so to protect against different types of knee injuries, more MCL, which is the ligament on the inside of the knee. And that's because you have 300-pound guys that are landing on the side of your leg, forcing it in directions that it shouldn't be going. So that's where those braces are really handy and actually can be helpful in preventing injuries. But no, I would say that there's no evidence really to support bracing for ACL injury prevention.
That's good to hear, because that's what I've been saying. My second thing was creatine powder. The number of teenage boys who come in taking creatine, and I'm like, you shouldn't be doing it. Are there any benefits? What are the harms? And I keep telling them, just eat healthy foods. But I keep hearing creatine, creatine, creatine.
That was on my list too. That and protein
Yeah.
and protein
Powders constantly.
Right?
Yes.
Yeah, I think you guys are doing it correctly. Ultimately, most teenagers don't need to be taking that stuff, unless they're really, creatine has very specific beneficial effects. And it's generally safe. So, if they're persistent on doing it, it shouldn't keep you up at night as a pediatrician, right? As long as it's administered properly. But really, it's only helpful for sporting activities that require very short bursts of energy. So, for example, it could potentially be beneficial in wrestlers, for example, or is a good little cohort. And that's where it can come in handy for weightlifting, right? Because those are short bursts of energy. So it can potentially augment, but really, unless you're trying to enter into bodybuilding competitions, it's probably just a waste of money, to be honest with you. It's just not necessary. I think your counseling is correct, but like I said, it's generally safe, and as long as it's done properly, it's not anything to worry about. Protein powder, I feel pretty similarly about. That really more so pertains to people that are doing a lot of resistance training, because potentially if they're not getting enough protein in their diet, then that can help to regenerate and rebuild muscles after the natural injury that occurs to the muscle fibers with resistance training. But if you're a cross-country runner, for example, you don't necessarily need to take protein powder. And to go back to your point, Eric, right, as long as you're eating a proper diet, right, you're making sure to incorporate proper recommended amounts of dietary protein, then usually you don't need to supplement with protein powder.
Yeah, I tell them eat the food, eat the healthy high protein foods, and hopefully they're going to be eating the fruits and vegetables along with it, not filling up on just the protein powder shake. Is my
Exactly.
thought process.
So I have a
My
question for the parents out there. When you talk about working out, eating before, eating after, protein, carbs, is there some guidance on that for adults too?
Yeah, I think it's important to
asking
eat.
for a friend.
Yeah, this is helpful for everybody. I think generally speaking, as it pertains to diet and weightlifting, you shouldn't be lifting weights on an empty stomach. You shouldn't be, following a period of fast by weightlifting. You're just setting yourself up to fatigue too quickly. You need those energy stores in your body and readily accessible in order to convert them and generate those into your strength. But it also makes sense to not eat too quickly or soon before exercise, because that potentially increases the risk of cramping. So I would say the sweet spot is probably somewhere around 3 hours before 2 to 3 hours working out. Now, obviously, if you have a child or you have diabetes, right, that is potentially going to be different. You're going to need to maintain your blood sugars and make sure those don't go too low. But generally speaking, you should not overeat around 2 to 3 hours before a workout. That's also when, if you haven't already, proper hydration starts, making sure to get enough water in the system. It's not enough just to chug a lot of water, 30 minutes into an exercise. You really have to start it beforehand. And then the protein powder, as it relates to timing, I guess, I haven't really looked into that specifically, but probably makes more sense to, and the programs that I've seen have more so incorporated kind of after, but I've also seen, some that do before. So, to be honest with you, I'd have to look up and see what the most current recommendations are. If there's even data out there about best time to, incorporate protein supplements. And did that fully answer your question? I feel like there was another step that I missed.
Thank you.
Okay.
And
all right.
Speaking of hydration, do you want to comment on Gatorade and other sports electrolyte drinks?
Yeah. Generally speaking, water is fine and sufficient. It all really goes back to the normal diet, right? So as long as you're having and eating a proper diet, then you're probably getting electrolytes elsewhere. You don't necessarily need to chug Gatorade. Gatorade is also super sugary. And for patients who are struggling with their weight, I'm sure you would both agree, the first and easiest recommendation is to just cut out sugar-filled beverages. So that's always something that we talk about. And if you really love Gatorade, then I would at least spill out half or put half in another bottle and then dilute it with water. You're still getting plenty of the electrolytes that you would be getting otherwise, just with half the sugar. I would say pre-hydration doesn't make sense with those types of drinks. Really, beforehand, you should just be focusing on water. If you're engaging in very rigorous activity, then that's where, and you're sweating a lot, then potentially that's where there is a beneficial role for Gatorade or Powerade.
Thank you.
Hmm?
What
Eric?
about caffeine? We hear the kid, a lot of my teenagers are like, I have a Red Bull, I have a whatever the new one is, protein, caffeine because it's going to help.
Celsius.
Oh, yeah.
Yeah, I'm seeing a lot of that as well. Um, if you're a teenager and you don't have enough energy to work out without needing caffeine, it's probably because A, you're not sleeping well enough or enough. It's pretty much that. You really shouldn't, if you're young, need caffeine supplement to motivate yourself to work out. Um, and it's not necessarily going to be helpful, and it's going to be rare, but there are, certain situations, right, with kids who have maybe an underlying undiagnosed heart condition, right? Caffeine is a stimulant. So it's going to increase heart rate and potentially could be the, factor that sets someone over the edge in terms of developing a serious adverse event, cardiac adverse event. So I don't really recommend caffeine. In fact, I would probably recommend against it. And if you're saying that you need it to get through a workout, then the focus needs to be on how can we improve your sleep, not how can we get as much caffeine in your system as possible.
And I have one more question. While I have a captured expert, um, I have a bunch of patients who do competitive dance.
Mhm.
Is there a preventative, besides what you've already discussed? These kids are dancing 2, 4 hours a day, and a lot of the dance is very physical, not only aerobically, but they're jumping and flying through the air kind of thing. So I keep telling them this is a sport and you're going to injure yourself. Is there any preventative exercise or something we can help these kids prevent injuries? Because there's a lot of ankle, knee, hip injuries in these kids.
Absolutely. I really like treating dancers. I was very fortunate in my fellowship to have a lot of experience working at the Harkness Center for Dance Injuries and at NYU, working with a lot of professional ballerinas and dancers of the like. And it's no joke. What they put their bodies through is absolutely intense. And these are some of the most incredible athletes I see are dancers. And you're absolutely right. They are subjected to some of the most rigorous training out there. I would say it's probably dancers and competitive gymnasts that I see with the longest and most intense hours. Um, and it goes into kind of that early sports specialization and making sure to build in, proper rest time. It's a very challenging group to work with because they are very highly motivated, and these classes are so competitive that and they're often very rigid in their expectations. These classes, a lot of times, I try to talk to parents about, like, let me write you a letter, we need to cut down on the hours per week, like however I can help you do that. That's ultimately, to answer your question, that's what it boils down to, is they're just doing too much throughout the week, right? Especially if it's a 10-year-old and they're doing, 3 hours per day, 6 days a week, right? You go back to that rule of thumb. They shouldn't be doing more than 10 hours per week. And I tell parents that, and that gets a lot of raised eyebrows because there's a lot of very surprised parents that don't even necessarily understand just how much their kids are overdoing it. So I think as a provider, the most helpful thing you can do is have that conversation about, what do we know about hour limits and as it pertains to injury risk, and offer your services however possible to try to allow for these, dance professors and classes to accommodate them, allow it to build in some rest time. Maybe they still do the 3 hours a day, but then they have 2 or 3 rest days per week, right? And you're going to be met with a lot of resistance, and that's just part of working with this group. Is, if they don't do it, then they fall behind. And I think, as long as you have an honest conversation with the parents and the athlete about the risks involved, that's all you can really do. So it really just comes down to trying to build in rest time and increase education as it pertains to overuse injuries.
Thank you.
So I know we didn't get into concussions, and that's a whole separate topic, but I have a question about heading the ball in soccer. Right? For a while, that was, people weren't doing it, and then there were the things on the head, and like, where do we stand with that?
So prevalence of concussion in soccer is very high. In fact, in female soccer, it's the second highest rate, second to football. So it's still very common. And a lot of times it is from a heading mechanism. A lot of other times there's, head-to-head contact or head to other body part contact, or also pretty commonly is they'll fall and suffer a concussion via a whiplash mechanism. So there is probably will be emerging better evidence with time about using these very specialized protective caps, which have been very slow to catch on, mainly because of their aesthetic. But I do think that they can be helpful. And so I do at least talk about those with my concussion soccer athletes. And, especially if they've had 1 or 2 and they're really, they really want to continue with soccer, I say, I know you're going to look a little funny in this, but, if it allows you to stay on the field and stay healthy, ultimately that's what's most important, right? So that's how I like to reframe things for these kind of student athletes. There is also good evidence to support kind of neuromuscular training programs to work on neck strengthening in soccer players. So in addition to, similarly to like the FIFA 11 for ACL, working on neck strengthening and working on the ability to decelerate the head when it's falling. So that's where typically whiplash type mechanisms occur, is that the neck moves and the head follows. And if we can't engage our neck muscles quickly enough or strongly enough, then the head really accelerates through that motion. And then it's from that acceleration and then deceleration when it either hits the ground or the athlete tries to jerk it back, where there is sometimes a little movement within the skull, and potentially that can lead to the brain injury, the concussion. So if we can work on our athletes on trying to work on some neck strengthening, that can go a long way. There's also, going back to the NFL, the quarterback from the Miami Dolphins, Tua Tagovailoa, very famously had 3 concussions last year. There was a lot of talk about him retiring or being medically retired from football. Ultimately, he decided to come back, and he will be playing this year. Knock on wood, hopefully he stays healthy. But one of the things, very interestingly to me, that he did in the offseason was jujitsu, because jujitsu teaches people to learn how to fall properly. And so if you're in situations where you're going up for headers and you're constantly falling down, or if you're a football player and you're getting tackled all the time, to learn how to fall gracefully and properly and avoid that kind of whiplash mechanism can go a long way in concussion prevention as well. So that's something that I've just recently started talking about with student athletes, and is a perfect segue to the importance of not just playing football year round, right? You're going to be doing something else. It's going to diversify and make you a better athlete in general.
So we had a question in the chat, and I'll read it directly. You might understand it better. Is turf harmful for heat or concussions? Maybe it's supposed to be head. I don't know.
No, turf.
And heat.
And yeah, if it is heat, it's a difficult question to answer broadly because there's different kinds of turf out there. using different types of synthetic material and different kind of pellets. Some of them can get extremely hot. So, especially in the dog days of summer, kids are coming back, for football preseason, they're doing 2 or 3 a day sessions. Really paramount to, encourage proper hydration and diet in those situations. And also make sure that, coaches are well educated in heat injury prevention. So yes, potentially turf is a risk factor for heat related injuries. Is turf harmful for concussions? It's a good question. It's not something that I've necessarily thought about. I guess it depends on what you're comparing it to. If you're playing on concrete and you come down and land on your head, then yeah, I'd rather land on turf. It's going to be softer. But if it's soft grass, then the opposite may be true. I don't know that it's necessarily something that's been studied. It's a little difficult to study. I'd want to, kind of figure out exactly what the outcome measure is. Does turf increase the rate of concussions? I'm not sure. It's a good question. I'll look into it.
Thank you. And last question, you just mentioned again the hydration and the 2 and 3 practices a day, which is absolutely happening. By the time your child gets there, it's too late for the coach to do the right thing. Can you give us just a rule of thumb as to how much they need to be drinking and when it needs to start?
Yeah, I think there's rule of thumbs put out there by the AAP. I'm trying to remember offhand. I think it's starting at age 5. You should be drinking at least that many cups of 8-ounce cups per water per day, and then it increases 1 cup per year. So a 6-year-old should be having 6 cups, of 8-ounce, and a 7, and so forth, maxing out at around 8, which is the typical, 7, 8. That's the adult recommendation. Really, there's very few consequences to overhydrating, other than just having to go to the bathroom a lot. So I would say, especially in those scenarios where there's going to be exhaustive and prolonged physical exertion, better to just be on the overly conservative side and make sure that you're overdoing it with regards to water. I think that's how I would approach that question.
Great. So we're just at the hour. Is there anything you want to say as we close?
I think that's it. I'm grateful for the opportunity to speak. I hope everybody was able to learn something, and take away things for your practices as pediatricians, and also for your own health or for your child's health. So I'd be happy if there's any further questions. You can reach out and email me. You can get my email through the moderators. Happy to answer any questions, and I appreciate the opportunity to speak for y'all tonight.
Great. Thank you very much. And thank you, Dr.
Thank you.
Levine, for helping to set this up and for bringing Dr. Greene to us.
Thank you.
Good night,
Thanks.
everyone.
Have a
Good
great
night.
night.